heels.
Heels.
Feeling on his foot, so it needs to be protected.
Is right. No protective sensation. Tell me about protection. How do we do it? What are some? There's different ways. Tell me some different ones.
How will you put a pillow under closing the heels?
Waffle boots.
Waffle boots.
Yeah, waffle boots is one way. Good.
Well, we can do both as long as it's hanging, right?
Right. Yes. Yes. I love how you worded that.
Yeah.
Yes. So there's nothing touching the back of the heel. So by floating, let's get a pillow. Get a pillow. Now, sometimes I'll see this.
No, not underneath me.
Because if it gives them too much room, they'll go right back.
And sometimes I'll see
Sorry.
this. Why is that wrong?
Well, it's such a
Because
pillow.
the pillow, the heels are still.
They still have pressure on it. Yeah, so you've got a soft surface, but you still have pressure on it.
Well, these pillows, it'll deflate in an hour and they'll be back on the mattress.
Right, good. What other, tell me some other areas that are high risk. We talked about heels. We talked about sacrum just now. Tell me some other ones.
Sometimes their elbows, like
Yep.
back of the
Elbows.
head.
Right, right. Right there, the bony prominence. Back of the head is another one.
Bony part of your shoulder, depending how skinny you are.
Spine, right, right. Good. We talked about moisture a while ago. So when do you put on your barrier paste?
Every time you clean the patient, after every bathroom check.
Yeah. Which patients need barrier paste?
The less mobile.
Yeah.
Incontinent patients.
Incontinent. Or even like bowel prep folks. Lactulose people, C. diff. Let's see. So we talked about barrier paste. Have you guys used? We got some other types of barrier stuff too. So let's look at all of these. I don't know what this one is for.
That's
Just
This is
moisturizer.
moisturizer.
Moisturizer. When do you use that?
on other skin.
Dry,
Dry
skin is dry. Patients sometimes asking, and sometimes you see flaky, but not damaged.
Right, right.
And then you put on arms and legs.
I like that.
After
Or if they're
bath.
like
So
complaining about itching.
dry, flaky, itching is good.
After
Didn't
bath,
want to overthink that, but yes, good.
after
Good.
bath.
After a
also.
bath.
Yeah.
Once a day, very
Well,
good.
itchy from like dryness, not if there's something else going on.
Exactly. I was like, I don't want to go the wrong direction here. Barrier pastes are routine barrier paste, right? You might also see this one. Same thing. What's the active ingredient? You might know. Zinc. So at least this one says zinc, but you already know this one says zinc. Barrier fluid. You guys seen this one?
Yes. In the blue bags, if the wound,
Yes.
in their
Right.
wound orders.
Yes. Yeah, I like. So what are the blue bags for? What do we do with the blue bags?
All the root supplies are in there.
Yeah.
Yes, good.
For root changes.
Right. That means we're following. Right, right. And always a good thing to let your PCAs know too if you're using a specialty product like this one. Very good. There's another product. Trying to grab most of the gamut here. So how about this one? Tell me about this. Have you guys seen this one?
Yeah, is that
You know
it's
what?
the wipe, it goes on every 3 days.
Yes.
It's a barrier.
Yeah, it's like a barrier.
Yes. Cavalon
Protective
Advanced.
Uh-huh.
Now it's not the same thing as the Cavalon No Stink
Cavalon
Skin
Advanced.
Barrier, the little squares. This one's different. So every 3 days. Now the biggest thing with this one is making sure we know who put it on and on what day and on what time.
Documented.
Right, right. Because if you use this one, can you use these two?
No.
Right. Because if you use this one, these will actually soften the polymers and actually kind of take this off, and then you don't have the same effect. So, right. So it's one or the other. One or the other.
What kind of patient would you use this one on?
It's there's a few different ways of doing the same thing. You can use this for different types of area, like the skin folds. You can use that to help protect from moisture. You can use it as an alternative incontinence-associated dermatitis treatment. So if they're just getting red, but for some reason you can't use this one like at the location of the PrimaFit, if they're getting broken down, you can't use the paste there. So you could use this one, but not in conjunction. You can't use both together in the same location.
It will be kind of cleaner because sometimes when we use this, it's becoming kind of flaky too, right?
Caked
Very
up,
hard,
or-
yes, like
yeah.
cakey and hard to clean. That would be a nice clean film.
Yeah.
Protective film on the skin.
Also, some patients that are like extra large have incontinence pieces plus like the skin fold problems. And so you're using Interdry, but you don't want to get paste on the Interdry. So you can use this in those locations to make sure they're not coming in contact with one another. It just gives you another option if you're having trouble with the Interdry getting contaminated with your pastes. That gives you another option. How about this one? If I use this external fecal pouching system,
Yeah.
tell me about that one. It's okay, you're good. You're just fine.
I'm not very good at placing them.
Well, okay. Anybody else use this?
Yeah, I've used it before.
Good. Good.
Yeah, so on patients that have lots of diarrhea and
Yeah.
C. diff, and you have them roll to the side, and you just kind of place it.
Yeah.
Clean the area
Over the
really well
opening.
first, and yeah.
That's good.
Keep
Yeah. Heat packs. Sometimes you need ostomy paste directly around the opening. This gives you a little bit better seal.
Very hard to keep it.
Yeah.
Hard to keep it on.
is.
How long is this good for? Anybody know?
The chef, if it's
Really,
not,
it's just 24 hours. It's supposed to be
Okay.
just 24 hours.
If it keeps 24.
Yeah.
Look, I'd rather say that I said it too often than not often enough.
But that's a better shift. You know, I mean, that's
Yeah, that's a better
that
shift.
helps, right? What's a contraindication for using this? When can you not use this one? Anybody know? If you have an
Skin
actual woke, yeah,
break-
yeah,
skin
good,
breakage,
yeah, no,
and,
fine.
Maybe pressure ulcers close
Yeah.
to.
If you got broken skin,
Broken skin, yeah.
you're not really supposed to use that.
Because that'll keep the nastiness there and keep the infection faster.
And then when you gotta remove it, you risk doing more damage.
Right.
That's the other piece of this one. If you have super fragile skin on somebody, 80s, 90s, paper thin skin, steroids, etc.,
We've come up against
careful
that.
with that because that can cause that mechanical trauma.
Yeah.
Good. All right. See, I think those are the big points on that piece. Everybody's seen these types of, I'm sure you use these all the time, these different foams. Now, often in our orders, we'll call these bordered foams, but that, some people don't know what that means. I just wanted to clarify. That just means it has a border on the outside, so it holds itself on better. So these are great forms of protection. I
use
found
it
that
a
these,
lot.
yeah, right. You know, these are actually really good to use around the ankle or the back of the heel, because they also cover the lateral malleus on both sides. So you've got extra forms of protection if you get that rotation of the foot. So
For skinny people on the backbone, that's perfect too.
yeah, right, spine, right. Sometimes you get that really protuberant spine. You always get that on really early. Okay, what else do I have over here? Interdry AG. Tell me about,
That's good.
anybody know Interdry AG? I know that you do, but that's not fair.
Moisture in the folds when,
Yes,
especially bariatric people,
Yes.
and not only bariatric,
Right.
because lots of folds.
yes,
On the
exactly.
breast.
Especially a breast.
Good, right. Even on the back at times, you know, so it's a, tell me about how to use it. Anybody?
Dry skin and just measure it, cut it, piece off, and
So if they have a skin fold, and supposing it's a big skin fold, because that's really where it's super important, and you have to like get under there to get to the skin fold, how much of this is enough? How do you know you've cut it to the correct size? I'm trying to lead you somewhere there.
well, it's the fold, so it should, I think, cover both sides. You spread evenly on both sides and then put fold over the fold. So it's not
Okay.
You want to add on to
But,
that?
yeah, the key to this is, here's the fold, but you want it sticking out.
Yes.
It needs to be sticking
Sticking
out
out.
of
Yeah,
that
yeah,
fold.
yeah.
because it's wicking that stuff
Takes the
away,
moisture
Right,
away.
right.
takes the moisture out.
Yes.
It has to, you have to leave a tail.
Leave it there.
Use this, leave
2
a
to 4
tail.
inches.
Uh-huh.
2 to 4
Yeah,
inches
it's-
specifically, right.
yeah.
What can you not use with Intertri?
Barrier.
Barrier paste?
Mhm.
Anything else?
Well, most all of that, but
Any kind of powders?
No.
So if the doctor writes for meconazole,
Yep.
or if your tech is using ostomy powder, you can't use those in conjunction because they block the pores and this won't pull the fluid away anymore. It will just sit static.
Oh.
But this doesn't absorb, so it sits real wet. So you have to, important things with that one.
so if you have a yeast infection in there, you don't use this, 'cause it's just not.
Well, so I mean, that's a tricky thing too, because this does have silver, it's Interdry AG, so it kills fungus and bacteria, so theoretically it's good, but if you've got
Some of the
if you
cream
got
like
fungal
that,
that extends out past the fold, this won't do anything for that.
Yeah, so if you're using something with it, you can't.
Yeah,
Yeah.
so if the doctor wrote for meconazole, can't use this one
Mhm.
unless you have that discussion. Okay, all right. Let's see what else. Do you know how often this has to be changed?
When you
Am I running over time?
every shift probably.
This
When you
every
clean it?
every 4 days. Every 4 days.
4 days.
So
Okay,
clean-
if you clean the patient and you see the traces of sweat or something, I will change. I will not put it back on the clean skin.
if it's contaminated, if it smells bad, I mean, if it's got
It's
something
wet,
else on
if
it,
it's wet,
urine
no.
or stool, yeah,
Yeah.
toss it of course, but it's good for 4 days.
Oh,
It's good for 4 days, yeah. So you can take it out, do the bath, put it back, get it all dry, and it'll do the trick.
Huh.
I feel like it always smells after I take it
Yeah.
out.
Yeah.
It always smells bad.
I
It
don't
always
feel
smells
In the
bad.
big folds,
Yeah,
right?
I don't
Cap-
like it. I mean,
capture
it is
lots of
collector
moisture.
sweat.
I feel like there's
BO.
reasons why they need it.
Let's see, what about devices? What kind of devices do you need to protect from? We talked about the NG tube and how to do the eye taping to make sure there's no pressure on the inner narrow. What other types of devices do you
Foley's.
see? Foley catheters, right? What's the problem with what are you watching for with a Foley catheter?
It's not underneath of their leg.
It's not under the leg, 'cause you don't want to cause some kind of pressure. What else? Don't want to have tension, right? It shouldn't be like, you can tell that's like pulling when you put your anchoring device and that kind of stuff. Okay, what else? Any other devices that you commonly see?
Sometimes a nasal cannula.
Nasal
can get
cannula.
in
Yeah, which areas on the nasal cannula are you watching for?
where the ears are.
Tops of the ears especially, but behind the ear it can be. Where else?
Right.
Yeah,
Yeah.
and the frenulum and the inner nares and all that stuff. Good.
Sometimes even along the side of the face here,
Mm-hmm.
I've had some people, start to get a little red.
Right. Yeah,
So-
especially if their face is swollen. We see that a lot in the ICU and stuff. Good. Okay, well that's a lot of the prevention stuff. We talked about all the turning, so we've got all that covered already. So it's good collaboration. Let's talk about